I'm the facility director at Greil Memorial Psychiatric Hospital in Montgomery, Alabama. We are a state psychiatric hospital operating under the auspices of the Alabama Department of Mental Health. We are a 76-bed adult psychiatric facility. In 2007, the Department of Mental Health in Alabama decided to seek the possibility of energy conservation measures for facilities in the state. Requests for proposal were put out, and 8 companies responded, and one was chosen based on their proposal. That company sent teams to our hospital to evaluate all of the different energy systems in place to determine where there might be savings and retrofitting or new equipment that could be put into place to improve the energy efficiency of the facility. After a lot of advanced planning and design, in January of 2008, work commenced here at the hospital. We undertook a lot of different things here in the hospital, including the first thing was replacement of the ballast in all of the lighting fixtures throughout the facility, and also energy efficient fluorescent tubes were replaced. Then work began on the heating and cooling systems of the hospital. A great deal of work was done in that area, including removing an old boiler and replacing it with 4 smaller, high-efficiency rapid heating boilers. A second existing boiler was converted from a steam boiler to a hot water boiler, and it is dual fuel capable. That is, it can run off of gas or it can run off of diesel fuel in the event of loss of utilities. The piping for the chillers and the heated water was replaced in a large section of the facility. And we found when the old pipes were removed that they had a lot of scale and clogged material in them, so that we have a much higher efficiency now with the new piping that is in place. All of the support systems, the electrical systems that govern the functioning of the heating and cooling system were replaced. Old conventional thermostats were replaced, and there is now a central control unit, computer-driven, in the maintenance department, so that the heating and cooling systems, the energy systems in the hospital can be monitored at any time from the maintenance director's office, and adjustments can be made in the temperature in different areas of the building to make it much more efficient. Of course, the purpose of all of this was to make a more efficient energy system, but also hopefully to save money in the long run. Once the 13 months of work was completed, beginning in February of 2009, the billing for the utilities was looked at on a monthly basis and compared to what we had in the past several years. We were guaranteed savings for that first 11 months of $65,000, and actually the savings were $105,900. So there was actually exceeded expectations and guaranteed rates that we hoped that we would get. So we are very pleased with that. In looking at the possibility of doing this in another facility, what we found with the company that was chosen, it was an excellent choice because they were highly organized and very goal-oriented. And once the engineers had designed the systems that were to be installed, then crews came onto the site under the supervision of a project manager. That project manager on a weekly basis would meet with me and my maintenance director and other staff and give us weekly updates of the work that was being done, what they hoped to accomplish during the next 7 days, and brought digital photographs to every meeting to actually document visually the work that was being done. So that made things really progress. Overall, we've had a tremendously positive experience with this based on working with an excellent company that had excellent management, and also people that really knew how to design a system so it would be much more efficient.